Yeah.
Hello.
Sir.
Hello. 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 You can hear me. Yeah. Good morning, everyone. It is indeed a proud privilege for me to welcome all of you to this press conference. And I have some of my colleagues who will be introduced now, starting from the extreme right, Dr. Padma Kumar, Medical Director, Sunrise Hospital, Cochin. Dr. Shiva is the head of obstetrics and gynecology of this hospital. And it is indeed my great privilege to introduce a very special person, Dr. Hafiz Padiyat. He is the chairman of the Sunrise Group of Hospitals, and he is a world-renowned laparoscopic gynae surgeon. And this meeting is all about a conference we will do very soon. And this is a conference where many world-renowned laparoscopic surgeons will meet in Cochin, and this will be telecasted to Rashid Auditorium this weekend. The program will be a 2 days live program plus 1 day teaching program, and during this period hundreds of surgery will be done and several doctors will be introduced. Let me introduce Dr. Hafiz Rahman. I am sure most of you know him, heard of him, but it's still my great pleasure to welcome him and to say a few words. Dr. Hafiz is a world-renowned laparoscopic gynae surgeon who holds the record of maximum number of laparoscopic gynae surgery in the world. He has performed nearly 75,000 surgeries, out of which around 25 to 30,000 are uterus-related surgery. He is also a teacher. He has trained over 5,000 doctors from all over the world. And if you look around, even in UAE, several of the leading laparoscopic surgeons are being trained under him. So without any further ado, let us welcome Dr. Hafiz.
First of all, let me welcome all of you, and thanks a lot from my heart for gathering here and making this first press conference on this workshop a good success as such. Now coming to this workshop, which is going to happen on 27th, 28th and 29th of this month. This is a combined workshop conducted by the Images. Images is actually the national organization of gynec laparoscopists in India, of which I am the president of Images for this year, and in combination with Sunrise Group of Hospitals in India and International Modern Hospitals in Dubai, as well as as in combination with Emirates Infertility Forum in Dubai. This is a very special occasion to announce such a conference, which is the first time happening in the entire United Arab Emirates. Around 35 world-renowned laparoscopic surgeons, especially gynecologists, are gathering in India, in Cochin, and they are doing the surgeries there. And this entire proceedings of surgeries will be relayed live through satellite to Al Rashid Auditorium in Dubai. This is the first time such a program is happening in Dubai. A live telecast from outside the country for an entire 2 days will be surgeries. And the highlight of these surgeries is, these surgeries are done by the best so far in the world. 30 best doctors all over the world are coming, and they will be doing the surgery and they will be teaching these surgeries by relaying it. Around 1,000 delegates will be assembling, more than 1,000 delegates will be assembling in Cochin, and around 200 to 300 delegates will be there in UAE. We have, in UAE actually, we have delegates coming from all over the Gulf, including from Pakistan and other places where they have problems in going to India. So visa problems will be there. We have delegates coming from Iraq, we have delegates coming from Qatar, we have delegates coming from Saudi, UAE, Pakistan, all these places. One of the biggest highlight of this program will be, the entire transmission will be HD transmission, and this will be the first time a 3-dimensional laparoscopy transmission will be done to UAE. And also robotic surgeries will be displayed in this program. Robotic surgeries means surgeries done by the robot. Of course, behind the robot will be the human being only. And this entire program is transmitted on to UAE Al Rashid Auditorium. This will be a two-way communication program. This will be usually workshops when it happens. The surgeries are done in the operation theatre and it is relayed on the screen for the doctors to see. And the doctors keep asking questions. And the surgeon can answer those questions, whatever query regarding the surgery, as well as the surgeon can keep teaching during the program. So in UAE also it will be a two-way, not only in Cochin, it will be a two-way communication. It will be just like another hall which is there, whether in Cochin or UAE, there won't be any difference, because the transmission nowadays is all so excellent. It's live, without any delay the transmission will be there. We have arranged all the facilities for this program. So this will be, I think, a landmark in the history, medical history of United Arab Emirates for such a conference, and we will hope that we can have further programs like this. And another announcement also we would like to make at this conference is that on December 16th, this is the first time in the history of UAE, December 16th, International Modern Hospital, from the operation theatre of International Modern Hospital, we are going to have a live relay in the American Association of Gynec Laparoscopy Conference. This is a great achievement for United Arab Emirates. This is the first time a hospital or a theatre in Dubai is having a live relay to US and teaching the US surgeons as how these surgeries can be performed. This will be simultaneously relayed in 25 centers across the Europe also. And this is totally a teaching program. And I think for Dubai, usually all these kind of things are relayed back from US to other countries, and this time this is relayed from Dubai to United Arab Emirates to the American AAGL. This is called AAGL, that is the American Association of Gynec Laparoscopists. So we just wanted to announce these two programs, which actually will be a big stepping stone in the medical history of United Arab Emirates. Thank you. Any questions from you?
So what is the process of surgery? Have you identified cases?
Yeah, we have already identified all the cases. This conference particularly will be only on two programs, two cases. One is removal of the uterus and the other one will be removal of fibroids. Just two subjects. And it's a huge response we have got on these two subjects. Because I think in the entire world, this will be the first time around 1,500 delegates are coming on these two subjects alone. Because none of the workshops have gathered so many numbers of delegates. And these delegates are coming from all over the world. It's not only from India or not only from UAE. They are coming from all over the world, and the faculty members also are coming from all over the world. We have faculty members from Austria, US, Spain, and we have given the brochure also.
You have mentioned the incidence of fibroid cases in the US are on the increase.
Yeah.
So what's the reason? Is it obesity, is it lifestyle, and what's the issue to use?
There are 2-3 reasons why it is increasing in the Middle East. Number one, see, compared to the other population, so if you see the other Asian population as well as the Caucasian population, Caucasian means the European and American population, the whites basically, compared to them, the incidence of fibroids are much higher in the Arab population as well as in the African population. Fibroids are basically genetic occurrence, has a genetic occurrence. It's a genetic thing. You are destined to have fibroids because of certain reasons, like diabetes or many other diseases. You are destined, when you are born, you are destined, or more prevalence can be there. Another thing which is happening in this part of the world is that delay in the age of marriage, which is a very, very important thing. The delay in the age of marriage and age of having children. Once this delay occurs, things like fibroid, endometriosis, all these problems start coming up. And what we have seen, especially in the African subcontinent, I used to do surgeries in Africa also. There what we have seen is the fibroids will be huge in size. The size will be very huge, very large, and the multiple numbers will be there. I'll tell you a special case which we operated just 3 days back. This patient had a uterus which had 35 fibroids in one uterus. This is a large number actually, and it was completely done laparoscopically. So that is a kind of fibroids which we see in this region altogether.
How much weight for that?
This patient actually the weight was very less. Not much, I think altogether maybe 1 kilo. But we have operated large fibroids also laparoscopically. The largest done in the world is around 5.4 kilogram, which is done laparoscopically, which is a size of more than a baby. You know, usually the babies will be around 3 kilogram.
We should be able to conceive after removal.
This patient who we have removed this 5.4 kilogram today has 2 children. Right on date has 2 children. She delivered 3 months back again.
Another question, since surgery process was key in the new work, the keyboard surgery, the robotic surgery is an answer for the
Exactly, that is very good question. Because see, laparoscopy started long back. I think 1964 laparoscopic surgery started, and 1989 major laparoscopic surgery started because of the advent of camera. Since then, see, all of you know that laparoscopic surgery is the best compared to open surgery. We all know, and everybody, every doctor knows. But still, even in US or even in advanced countries, only 30% of surgeries in the abdomen are done laparoscopically. The basic reason is basically there are less number of skilled surgeons. Or even if people are doing laparoscopy, they are not able to do beyond a certain extent. That's basically, see, most of the laparoscopic surgeries you need an ambidextrous nature. You should be able to work with both the hands, and it's a hand-eye coordination should be there. It's not very easy. Robotic surgery actually is coming into picture, taking care of this skill part a lot, because robotic surgery will help an average surgeon to become a highly skilled surgeon. What happens is the surgeon is sitting in a console and the robots will be standing in front of the patient. Actually the robots will be operating, but these robots are controlled by the surgeon. See, every surgeon has a basic thing called tremor and fatigue. These are the two basic things which creates problem for surgery, especially laparoscopic surgery, because laparoscopic surgery you have a magnification of 20 times. So if you have a tremor of 1 millimeter, on the screen it will be 2 centimeter tremor. You know, if your hand has slight tremor, on the screen it will be magnified. The tremor is also magnified. So when it goes through this robot, this tremor is filtered. See, robot will not have tremor. Even if your hands are having tremor, the tremor is filtered. So when you take a suturing like this, if you have a tremor and you are taking a suture like this, robot will take a clean suture. You know, that movement will be much cleaner. And another thing is fatigue will be less. After operating for some time, you keep holding like this and holding like that, then you have fatigue. The robotic arm, if you keep it at one position and leave it, whatever be the amount of time, it will hold like that exactly. So these kind of finer movements, and another thing is, see, for the hand you have movements like this on the wrist, or finger movements are there. In laparoscopic surgery you have an instrument going in, and the tip of the instrument cannot have movements like this, like a hand. These robotic instruments are specialized in such a way that you can have this other movements of the wrist basically. Not only the finger catching and cutting. You can have the movements of the wrist so that the surgeries will be much easier. It will be like an open surgeon can easily come into laparoscopic surgery if robotics come in. But the problem of robotics, it's very expensive. Very, very expensive. It's unbelievably expensive even in US. We have robotics in India, but in UAE still now we don't have robotics, but it will be coming. The cost of the robotic machine, if you say in Indian rupees, it is around 15 crore Indian rupee. That will come to, that's the machine. But the cost is not there. The cost of per surgery will be an additional, that the instrument cost which are disposable. In Indian rupee, it will be around 3 lakh Indian rupees per surgery. So that is why it is not becoming popular assets, because per surgery you have a 20,000 dirham extra cost of disposable, if you say in dirhams. The equipment cost may not be much actually.
It's a German technology?
It's a US based technology. It's called Da Vinci system. But now robots, see, they had the patent. I think next year the patent of robotics in surgery is going on. So I think after the patent goes off, a lot of companies from already Korean companies and Chinese companies and German companies have started coming into the picture. So I think after that the cost will come down. But definitely it's a very good system. Especially it may not be that good for a highly skilled surgeon, but for an average surgeon, to become a highly skilled surgeon, this will be effective. And I think this is the future tomorrow, because a lot of number of doctors should start doing laparoscopy, then only it will get promoted.
Good morning. These surgeries which we are planning during this workshop is done entirely free of cost for the patients in Cochin. All the 100 surgeries which we are planning to do on those 2-3 days will be completely free for the patients. We already collected patients. 50 surgeries, and rest of the surgeries will be done at later dates. Almost 50 surgeries will be telecast this side, and it will be done totally free for the patients. And we have taken special consent from them for doing that, as well as for telecast as system demands. So that will be a help for the patients as well. It's done by best of people, but free of cost. Otherwise it would cost in Cochin maybe around 1 lakh, and here maybe 40,000 dirhams. 40,000 dirhams. So that kind of a surgery is done free for them by the experts in the world.
Sir, with regards to the 100 surgeons, what are the backgrounds of the women, of the patients? Aside from having fibroids, so what are the cases of history?
No, we have all different types of patients. We have cancer patients in this, who are where the uterus has to be removed. We have patients who have fibroids. We have patients who have uterine prolapse. So all kinds of patients are there in different age groups are there, very young patients as well as very
what is the age range?
Old patients, patients from 20 years to 70 years.
Okay.
That is the age group of these patients, basically depending on the type of cases.
And
So,
all of them are from India?
all of them are from India. All the patients are from India because the surgeries are done in India.
Okay. So the purpose of this workshop conference is that you're sharing with international gynecologic laparoscopic surgeons the development in basically laparoscopy. Laparoscopy.
The purpose of this program as such is, we have two purposes. Number one, it is to promote laparoscopic surgery among the general population.
Okay.
That is number one. Because laparoscopic surgery needs a lot of promotion even today, even though we have been doing it since long. Because we know very clearly that this is the method of surgery. Today for uterus, I would put it to that extent that it will be totally unethical to even open the abdomen for removing a uterus or removing a fibroid. So,
okay, and in that instance, sir, it can be done on any case, like it's not only
Any
for
case.
Any medical case.
Any medical case.
Okay.
And number two is that to teach the doctors across the world on these methods. It will be like a threadbare, just 2 topics, 3 days.
Yeah.
So it will be a threadbare discussion on every single small aspect of these 2 topics. It's not like generalized everything in gynecology. It's just 2 topics we are taking, and we are going into the maximum depth of medical knowledge in these topics. And that is why we have the best of the surgeons across the world operating in this workshop. Everything, there will be a 3D transmission, there will be robotics, there will be the HD transmission, which is the usual laparoscopy also. Everything will be there. We have something called a mosulator. Through this keyhole you can put in that mosulator. The tip of the mosulator has a blade, and that blade cuts and sucks out the entire mass. You have to see to believe it actually. It's like computers, no? See, when computers came in, the people who were writing accounts, they could not believe how this computer is calculating so fast. So it is not difficult, it's very easy. Today it's like our daily routine job. In this hospital itself, every day we must be doing around 5 to 6 removal of fibroids.
Sir, on the incidence of on the drastic increase of fibroids in the Middle East, is that also related to stress? Because, you know...
No, it is nothing to do with stress like other diseases like maybe diabetes or hypertension or cardiac diseases. This is purely dependent on the unopposed, it is called unopposed action of estrogen hormone on the uterus.
Okay.
Which is unopposed action of estrogen hormone on the uterus, which is genetically prone to develop fibroids. Uterus is the RAM.
Yeah, okay.
Okay. You know, uterus is the womb.
Yes.
On the womb.
Yes.
Estrogen is a female hormone. If the female hormone is allowed to act unopposed on the estrogen, unopposed means normally in a female cycle, so you have a pregnancy.
Yeah.
That time the female hormone is opposed actually. It's not acting too much on the uterus. So in a pregnancy, 1 year the female hormone is not acting too much with progesterone only because it is opposed. So the uterus actually gets a kind of rest. So if the uterus is exposed to an unopposed action of this estrogen on a genetically prone uterus, not on all uterus, if that patient is genetically prone to develop fibroids, like the African patients which I was telling, those patients can develop fibroids. Because in India, why we see fibroids is because in India and many other countries like China or wherever there is a population restriction basically, you have started seeing more fibroids. Basically because you are restricting. This restriction is actually an unnatural restriction because of various social reasons we have.
Yeah.
I'm not against those social reasons, but
yes.
this is an unnatural restriction or an artificial restriction. So the number of fibroids naturally will increase. But in this part of the world, we don't have a restriction on the childbearing. But
Yeah.
the age of marriage is getting delayed. People get married at 30 years, 35 years, even 40 years. Then by the time the uterus is developing fibroids.
Since it is genetically predisposed,
Genetically.
is it possible to detect it early, or is there any mechanism?
Right now, we don't have any mechanism to detect this thing early. Many of the genetic diseases, we are not able to detect it early. But many of them, almost say 5% are detected early. We have something called pre-implantation genetics. See, like things like Down syndrome or maybe some other chromosomal diseases. When we do IVF, in vitro fertilization, we can take out the chromosome, detect that this patient is this embryo as such is not having this particular disease, and transfer that embryo, those embryos which are normal. But this genetic thing is going to come in a big way. I think next 10 to 15 years, every child born may be screened of certain diseases in the family. See, like I'll tell you something like ovarian cancer. Even ovarian cancers, you have a genetic screening on the live patient also. Like BRCA1, BRCA2, you can screen and say that this patient may get ovarian cancer tomorrow. If her sister was having ovarian cancer, that sisters and mothers and all this female population in the family can be screened, and we can predict ovarian cancer. So those kind of things are there, but not right now for fibroids.
If the only solution, removal is the only solution for the fibroids?
Right now there are many solutions. See, one is HYFU, that is high intensity focused ultrasound. We don't have it in UAE, but we have it in Cochin, in Sunrise Hospital in India, which can actually burn these fibroids and reduce the size. But it doesn't go off completely. Almost 30%, 40% reduction will occur with this HYFU. The ideal solution is only removing this fibroids. No other solution. All the other solutions are temporary basis. You can give medicines and reduce the size of the fibroid, reduce the symptoms due to fibroids, but ultimate cure is removing these fibroids or removing the uterus.
Good afternoon, everyone. Just as a healthcare provider, I just want to highlight a few things about International Modern Hospital. First thing is that, as we have already said, it's a center of excellence for minimal invasive surgery or keyhole surgeries, which includes laparoscopy, hysteroscopy, the surgeries for stress incontinence or urinary incontinence. All these things, we have a very good unit here, and headed by, we are blessed with Dr. Hafiz Rahman, who is as we discussed, he's the laparoscope is par excellence. I have to no other word I can tell about him. And a good team of laparoscopic surgeons we have, and so we are giving this service to the people here. And actually, we can call as a tertiary center for laparoscopic surgeries in UAE and Middle East. We are getting a lot of referrals from throughout the Middle East for laparoscopic surgery, including cancer surgery, and which is a very, very difficult surgery, can be done by laparoscopy. We are doing in our center. And the second thing which I would like to tell is a feto-maternal unit and women wellness unit we have here. And we are catering high-risk obstetric cases. And we are specialists in high-risk cases and specialized in obstetric medicine, and with the help of other departments which is very well developed in this hospital, like the physicians and the cardiologist, and we have a dedicated intensive care unit. We are able to deliver a high standard of care, especially in high-risk obstetrics. And we are really very happy and very excited about this conference which Dr. Hafiz has mentioned, and we are expecting a very good response from our colleagues and the general population of UAE.
Ma'am, question, I'm sorry. In your experience, because you're the head of the OB/GYN here, just give us the benchmark, or how many cases, how many fibroid cases do you have in the past 5 years, for example, throughout the region and particularly in the UAE, so that we could really say that this is a big problem now.
Yeah, if you take 100 women, or about 8 to 10% incidents we are noticing in UAE. As we already mentioned, it is more in Arab population, and we have a lot of expats, including the Afro-Caribbean. In them also a lot of from Africans, they are also more prone to fibroids. And in our hospital, actually, we are doing around more than 100 laparoscopic surgeries in 1 month.
More than 100
laparoscopic, including the hysteroscopic, minimal invasive surgeries.
And this majority of this is with regards to fibroid cases?
And not like that. In a lot of other cases like endometriosis, other pathologies are also there.
Women's diseases.
Women's diseases.
Any further questions? I'm sure you feel free to please approach us in case you have any technical questions. We're more than happy as we've seen the experts on laparoscopic procedures, especially under gynecology. With that being said, I also want to take the opportunity to highlight that, as you can see, International Modern Hospital, we are a multi-specialty hospital, but truly our strength is more on the minimally invasive surgeries. And some of the other departments I'd like to highlight is, starting with OBGYN, we have orthopedics, general surgery, urology, and some of the other departments which are really strong on minimally invasive surgeries. I'd like to thank each and every member from the press, especially the General Media Forum, and I'd like to thank you once again for joining us and making this event a successful one. Last but not the least, we are very keen to take a long-term approach on the educational part, on the academic front. So you can certainly look forward to more initiatives like HYFICON in the coming year. And we look forward to everybody's support and participation. Thank you, gentlemen. Thank you once again. Have a wonderful day. Thank you.